Guys, thank you for giving me an opportunity to share with you guys this lecture on workforce safety. I want to apologize for having to kind of provide this lecture via this format, via video, but unfortunately we sort of lost an opportunity to do this within class. So if you would just bear with me and we'll get through this. I also wanted to apologize for some of the background noise. I'm currently recording this while I'm actually working on duty. So bear with me and we will get through this together. Workforce safety in this particular lecture is going to go over a couple different areas that I think are kind of important to our EMS profession. One of the things that we are going to face throughout this particular profession is different emotional reactions that you're going to experience within this field due to death and dying. Some of those are going to be difficult for some of you that have never experienced death. And so these are going to bring up different feelings. There is no doubt in my mind that this job is not at times stressful. And so different stresses that come up in our life may or may not affect you. And so the goal of this whole lecture is to kind of give you some insight to some of those stresses that you might come across and some of the difficult challenges that we face in this particular career. In addition to that, I'm going to be discussing kind of how family members interact with the idea of death and dying, especially of their loved ones, and then also how do we as providers approach those individuals, their families, when they're kind of going through that process where they found that their loved one has died or is dying. In addition to that, there are definite reactions that family members can exhibit, and those are things that we sort of need to recognize and react a certain way. There is definitely a right way to react to that and a wrong way. In addition to that, because of this job and the things that we see, there are times where we see folks that are in severe distress. We may see multiple different people that are in severe distress, and sometimes those can bring on stresses in our own life that require us to go through a critical incident stress debriefing, and some of those signs and symptoms may occur for you as the provider in a particular situation where you need to recognize those signs and symptoms so that you can receive help due to the fact of the emotional and physical stress that this job can bring on. In addition to that, there are healthy ways to alleviate stress, and there's also unhealthy ways. And so when we recognize that, we can hopefully debrief ourselves and some of the images and some of the things that we interact with. And then also, most importantly, and again, this is going to be a test question, but most importantly, we need to also make sure that our scene is always safe. And so we're going to discuss briefly about that. Now, I will warn you, this is something that I like to go over within class, and I will spend a little bit of time next time we see each other as far as scene safety and kind of acting out some different situations and hopefully giving you some sort of insight in the event that you face an unsafe situation, that you kind of know how to sort of act and react in that particular situation. In addition to that, we're going to discuss the importance of body substance isolation and the different steps that we take to protect ourselves against both blood products as well as things that are within the air. This may be from a patient who's actively bleeding, or this may be from a patient who's actively coughing. And then also the different personal protective equipment that you might see in this particular field, both in the pre-hospital setting, in the fire department setting, as well as possibly even the hospital setting. So to kind of start this off, when we talk about the EMT and this whole idea of the EMT and the well-being of the EMT. One of the things that is most important is you as the provider. You are most important. If you are not protected, if you're not healthy, if you're not well enough to handle the job, you're not going to be effective in helping others in the reason they've called you. Okay, they're going to activate 911 and they're going to call upon you, and you're going to show up, and it is your job to help them figure out whatever that problem is, whether it be a medical problem, whether it be a psychiatric problem, or whether it be just a roundabout problem. You're going to be called for most of the time to deal with that problem and to help them solve that problem. In the midst of that, there are going to be hazards and things that you're going to come across, whether it be a violent patient because they're having a psychotic breakdown, or maybe they're overwhelmed with life, and you're going to need to help them through that.